Okay, we're going to start talking about the muscular system, part two. All right, so the learning objectives here, I want to talk about simply just the medical terms of the body movement. There are a lot of medical terms as it relates to movement of the body, so we're going to touch on some of them. Okay, so flexion and extension. A lot of times you're thinking when you're flexing your muscles and extension, that's kind of almost self-explanatory. But flexion simply refers to the movement that decreases the angle between two body parts. Flexion, thinking of when you're flexing maybe your muscles, your biceps or something like that. Flexion at the elbow is decreasing the elbow between the ulna and the humerus. And you can, of course, have flexion of the legs as well as the arms. And I'll show you some examples here in a second here. And then extension is simply just the reverse. Extension refers to the movement that increases the angle between the two body parts. So when you're extending out, okay, maybe your hand or moving your elbow, or having movement from the elbow, moving your hand further away from your body, okay? So that is simply going to be known as extension, all right? So let's look at some examples here, all right? So flexion, okay? Kind of more so away, all right? Or say if you're bringing this up towards, flexing your muscles, all right? Flexion, sorry, like so, decreasing the angle, all right? Whereas extension, extending out. Extension, extending out. Okay, so this is just a picture showing flexion and extension relative to both the arms and the legs. Again, flexion, bowing your head. So this would be an act of flexion. All right, extension, bring your head back. All right, so you're here flexion, you're decreasing the angle, and then here you're increasing the angle back. All right, again, flexion. You want to flex your muscles, make muscles to contract those biceps. All right, flexing your muscles. That's flexion. All right, extension. All right, and that's going to not cause any. It's not going to cause your biceps to contract, but actually, conversely, going to cause your triceps to contract. But nonetheless, this is in terms of the terminology. This is extension. You're increasing the angle. Okay, so we have abduction and adduction. All right, so abduction, moving away, moving a segment away from the midline. So when we think about the midline, folks, really we need to be thinking about in terms of kind of like just like the middle part of the body. Okay, so I'm making a color or anything like that, but simply just the middle part of the body. All right, so that's the midline. So that should give you like a reference point. Midline. Okay. All right. So moving segment away from the midline. All right. Abduction. So again, here's the midline and you're moving it away. Abduction. All right. Adduction, when you bring it back, when you're moving it towards the midline. Okay. So again, the midline, just think of the midline simply just kind of like, basically like your spinal cord. That's the middle part of the body. All right. So those are very important to simply to know. All right. So abduct, take away from midline. Adduct, add or towards the midline. Okay. Yet again, abduction. Moving our muscles, moving our body parts away from midline. Again, remember, midline. Okay? And adduction, bringing it towards midline. All right. Other terms, pronation or pronated, neutral, supinated. To pronate. A lot of times we talk about this, I guess, more so like with feet and so on and so forth, and that's to turn or hold. Well, I mean, of course, with the hands as well or anything like that, but a lot of times, particularly with orthopedics, well, of course, they'll deal with the hands, but a lot of times, at least with me, I might hear a little bit more with the feet there, but it's basically just any limb, really, technically to cover them all. And that's basically where the palm of the sole is facing downward and inward. All right, so that's basically facing downward and inward. So it's pronated, facing inward. Okay. Outward roll of the feet, all right, or the foot, all right, and that's supination or supinate, and then you have the neutral. It's going right down. It's normal, all right. All right, inversion and aversion. Okay, inversion aversion refers to the movement that tilts the sole of the feet either away or towards. So again, yet again, still keep in mind midline, 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 midline. So inversion is simply just turning the ankle so that the plantar surface of the foot faces medially. Medially simply means closer to midline. Closer to midline. So inversion, all right, so think of, because this looks like it will be the left foot, so inversion, turning it towards the spinal cord, the midline. Eversion, kind of evading, all right, laterally. So eversion, turn the ankle so that the plantar surface, the foot faces laterally. What's laterally? Further away from the midline. All right, so of course those are opposite terms. Opposition, very easy. Elevation, depression, so elevation up, depression down. That's pretty easy. I mean, that's the easy way to remember. Think of elevation going up, depression when someone might be feeling depressed and feeling down. And then we have kind of the shrugging of the shoulders. Elevation with the shoulders going up, elevate. Depression, coming down, bringing down. Okay, rotation and circumduction. All right. So I do want to kind of show this though. We have the lateral rotation. That's the circular movement in which the limb rotates on the axis. So we have the lateral, okay, going away the midline. Again, midline. All right. And then we have medial rotation going towards. And this is just rotation in terms of a person shaking their head. Okay. And then circumduction, just simply kind of, in a sense, like a circle. All right. Next slide. Talking about rotation, circumduction. So circumduction, moving a part so the end moves in a circular path. You do it with your fingers or other extremities. So circumduction. All right. And rotation is just moving it or just kind of twisting it. So it's not a full circle, but just twisting it. Okay, like your hand or your leg, because you will not have the ability to actually go really like in a circle in a 360-degree manner.